And thank you for joining us here on this Thursday. We have a lot of information to share with you. Mayor Demings will discuss the latest information regarding our COVID-19 testing numbers, CARES Act funding programs for small businesses, eviction diversion, small grants, other information, and good news on a local sports team. City of Orlando Mayor Buddy Dyer will discuss that good news as well, and he will discuss all things COVID-19 as it relates to the aforementioned City of Orlando and other details. And from the Florida Department of Health here in Orange County, no Dr. Pino today, but not to worry. We have with us Alvina Chu, who was the Epidemiology Program Manager for the Florida Department of Health here in Orange County. We start our comments tonight with Mayor Demings. Mayor?
All right, thank you, Dr. Williamson, and thank you to all of you for being here, especially on a day where it can be a little rainy here in Florida, in Central Florida. I will say this as we start this press conference. We seem to keep having to deal with a dual crises of potential crises in our community between the weather phenomena as well as the pandemic itself. But our county is aptly ready to deal with any of it. And so we are going through the process now, monitoring the various storms and making certain that we're prepared either way. So with that, let me just kind of start today and talk a little bit about where we are with the pandemic itself. We remain laser focused on making certain that we stop the spread of the virus in our community. But Orange County now has a total of 34,135 different COVID-19 cases that have been reported within our county. That's an increase of 197 cases just since yesterday. And while that sounds bad on itself, and it very well may be, we do have to focus on the fact that that's the lowest day-over-day percentage within the last 8 weeks, and I'll come back and talk about that. But we also have 359 residents who have died as a result of the virus itself, and so those numbers are continuing to just creep up each day. And for all those families who are continuing to wrestle with the virus and being impacted directly, we certainly pray for their families who are dealing with this. And today, I know that some of you will miss Dr. Pino from giving his update, but Ms. Alvina Chu is very capable of answering all the tough questions that you might have today. And I know that Ms. Lauren Seabrook will miss Dr. Pino. But going back to our daily positivity rate, since yesterday, the day-over-day rate, the lowest we've seen in 2 months, 5.23%. That's pretty extraordinary when you think about that. The average daily positivity rate for Orange County is 6.7% for the last 14 days, and we're getting closer to that number of 5% or less, where it indicates that you have substantially contained the virus within your community. And so every day, if we as a community work together, we will be able to get closer to that number. Tomorrow is a big day here in Orange County for our children as they return to in-person learning within the school district. It's my understanding about 30% of the students will be returning to campus tomorrow. So that will certainly be something that we'll all be watching very carefully to make certain that our children return to school in a safe manner. Orange County Health Services has been offering free testing now for many weeks, and this week we are at the Econ Soccer Complex between 8 a.m. and 1 p.m. They will be there tomorrow. Next week we're going to move it back to the west side of the county, and we'll be located at Barnett Park on Tuesday through Friday of next week between the same hours, 8 a.m. to 1 p.m. Again, in order to make appointments so that you can get in and out in a timely manner, you can go to our website in advance at ocfl.net/Barnett Park to make appointments for next week. When we come each time, we update you about what we're doing with the various CARES Act funding to support our families, individuals, and our businesses. And so today I'm going to talk first about our small business grant program, which has been really a resounding success for us here within Orange County. We have helped over 4,500 small businesses with grants of $10,000 or more as a result of the CARES Act funding that we have received. The Orange County Controller has paid out $45.7 million so far. However, due to the number of applications that we have received for the $10,000 grants, I have to report that tomorrow we're going to close the portal at 5 p.m. Tomorrow on Friday, we will close the portal at 5 p.m. Our mission has been to distribute $65 million to Orange County small businesses, and we are on track to reach that goal with the remaining applications to be processed. We'll monitor that very closely, and if we have the opportunity in the future to reopen that, we will. But at this point, we believe that we have sufficient numbers that we will expend the planned allocation of $65 million. As far as our program that distributes micro grants for home-based businesses, we're still reviewing all of those applications. So far, we've paid an average of $2,500 to some 113 home-based businesses. That we had 1,500 applications submitted and plan to award approximately $3 million in the micro grants. This is, again, where businesses can get up to $3,000 for home-based businesses. In terms of rental assistance and utility assistance, that program has been going very well. We have paid out $1,255,250 to assist individuals and families with rental assistance and assistance with utilities and other assorted bills. Our COVID-19 eviction diversion program has developed well. Today, we have put up on our webpage at ocfl.net/eviction diversion information about the eviction diversion program. So that should be live as we speak. The application for the eviction diversion process will begin in just a few days. Tuesday next week, we will open the portal at 9 a.m. Both the landlord and tenant must agree to participate in the program and meet eligibility criteria. This program is for Orange County residents only. I repeat, Orange County residents only, and it will require that the landlord and tenant have a written lease agreement. Tenants must be at least 2 months past due on rent. And again, we are putting the information up today so that individuals can get prepared with their documentation. And again, that required documentation will be disclosed on our webpage at net/eviction diversion. You will not be able to submit your application without the proper documentation. So we want people to be prepared when we open up the portal next week. Make certain that you're having some conversations with your landlord in advance of that. Again, you can find that information at ocfl.net/eviction diversion. We hope to avoid evictions for between 5,000 and 8,000 families here within our community. And I'll shift now to talk a little bit about our compliance. Our strike teams have been going out for the last 30 days, and they have now visited some 1,300 sites throughout Orange County. Compliance numbers continue to rise with 87% compliance rates. We have now re-inspected 48 businesses that initially were not in compliance, but we are seeing that number increase. 8 out of 10 of them, or 80%, are now following the CDC guidelines regarding facial coverings, etc. And with that, I'm going to turn it over to Mayor Dyer at this point, and I'll reserve some comments for the end. Mayor Dyer.
Thank you, Mayor Demings, and I also remind everybody that we are in the middle of hurricane season. Feels like we're having a hurricane just about every afternoon out here, but that's just typical Florida weather. But we do have a couple tropical depressions that we're watching. Tropical Depression 13 is forecasted to move our way through the coming weekend, so we'll monitor that very closely. And Tropical Depression 14 formed today in the Caribbean and is looking like it's going to head towards Texas. But we want to stay weather aware. That means continuing to watch broadcasts where the storms are going and when they might be here. Storm preparedness is certainly not anything new in our community, but don't take anything for granted. Have your home emergency plans done, stock up on your necessary supplies, and you can get more information at orlando.gov/I'm ready. As we continue with hurricane preparedness, we must also remain committed to doing our part to stop the spread of COVID-19. I don't want to come to a meeting or a press conference without talking about wearing your mask. There really shouldn't be any political debate about wearing a mask. The proven science is it helps to stop the spread of COVID virus. So if we want to return to normal ever, you need to wear your mask. So let's not be complacent. We continue to do testing at our neighborhood sites. Every week we move to a different testing site. This next week will be at Englewood Neighborhood Center, Wednesday, August 26th from 9 a.m. to 1 p.m. And you can start making reservations there at orlando.gov Monday at 8 a.m. And I will mention, you probably saw that Orlando City released a press avail or a press release yesterday talking about their first home game, which will be next Wednesday. They've just concluded the tournament in the bubble, highly successful, came in second, and now the entire league is moving to a process where they are grouped according to teams that are closer to them. So we're grouped with Nashville, Atlanta, and Miami, and we'll begin the season, or re-begin the season, with a home and home against Miami. We'll be in Miami on Saturday, and then Miami will be here on Wednesday. They have a plan to allow fans to be at the game at 20% capacity in their stadium. It'll be all season ticket holders who have been certainly had a lot of information conveyed to them on what they needed to do and what was expected of them on game day. Or they've worked with Orlando Health as business ready team, and Orlando Health has approved the plan. I know they've had discussions with the health department. I had an opportunity to walk the stadium this morning and be briefed by Orlando Health and the team. MLS has signed off on it, and OPD and OFD are both working with the team to make sure that this game is conducted safely. I've seen the plan. I think it's extremely well done and well thought out, and I think they'll be successful with this. So with that, I would call on Ms. Chu.
Thank you. Thank you, Mayor Dyer, and I appreciate Dr. Pino sends his regrets. I'm sure it's the highlight of his day. As Mayor Demings previously mentioned, we've had a little over 34,000 positive cases reported to us since the beginning of the pandemic. For the total number of positive people tested in Orange County so far, it's almost 300,000. It's 292,288. And we've had, as the mayor previously also mentioned, unfortunately, 359 deaths. Just this past week, these 7 deaths were reported to us, and we want to express our deepest condolences to the friends, family, and loved ones of those who are struggling with trying to recover from the devastating loss. So the age range of these 7 deaths reported to us this past week is 52 to 88 years. A little over half are female, which is about what we see with the total number of cases so far. The positivity breakdown between male and female is about the same. All the 7 decedents have known underlying health conditions, and so this is one point that we want to continue to express, is that for those persons who have an underlying health condition, such as diabetes, some pre-existing comorbidities that involve the lungs or the heart, hypertension, We want you to take precautions to protect yourself because we know that you can be at risk for severe illness and potentially fatal outcomes. And so we want to protect you by wearing our masks, also social distancing. So all the preventive measures that we've put in place to protect our most vulnerable populations. So since the beginning of the pandemic, in March, we've seen a peak that occurred approximately in mid-July for the highest incidence of cases. And since then, there has been some fluctuations, but overall in the last several weeks, particularly last 2 months, as you can see, this is the epidemic curve. So it's the report of cases over time. From the beginning of our pandemic, we are optimistically cautious about the general slow decline that we are seeing. And so this is across all of the surveillance measures that we have. So the lab reported cases, the confirmed cases, and also we have other additional surveillance measures such as those in emergency departments. We do syndromic surveillance. So we look at influenza-like illness and COVID-like illnesses. And those are, very similar, and we're coming up to the flu season. So we also want to keep an eye on both of these types of syndromes. And if you can see over here on the right graph, the top and the bottom, for influenza-like and COVID-like illness, the general overall decline over the last several days. So, let's see. The percent positivity, as we have mentioned, has been declining as well. And so we're hoping that all of the measures that we've put into place all together, so there's not a single measure. As Mayor Dyer mentioned about the debates about the mask wearing or the debates about whether or not certain places should open or close, there's not a single intervention or measure that will by itself stop or halt transmission or decrease transmission, but all of the things that put together where we work collectively, the interventions, us, and to protect our community and our loved ones. Thank you.
All right, thank you, Ms. Hsu, and we'll open it up for questions. And I know Lauren Seabrook has a question for Ms. Hsu.
Mayor, I actually have a question for you today. Lauren Seabrook, Channel 9. I did a story earlier today about former mayor and current OCPS school board chair Teresa Jacobs calling for rapid testing for students and teachers. She said that this is really important to going back to school, but also she mentioned when she was mayor, she said that our health resources are underfunded here in Orange County compared to other counties. Can you talk about if that's still the case here? And then I'd love to hear from Mrs. Chu if there is any plan for rapid testing as well.
First, I'll defer to the Department of Health to talk about the rapid testing. I know that Dr. Pino addressed that, I believe, at the last press conference. But in terms of is the health department or health services underfunded? I think across America, they're underfunded. It's certainly underfunded here within the state of Florida, inclusive of mental health services. And so I can tell you that I've long been an advocate that we should increase across the board the funding for that. But what I will tell you is that here within Orange County, out of the CARES Act funding that we have been allocated, testing is something that has been very important to all of us. As it relates specifically to the schools, I know that Dr. Pino responded to this, and he said that the Department of Health had set aside some 10,000, I think was the number of testing kits just for the schools should there be an outbreak. And someone here also asked him the question about the rapid tests, and he said that they were in negotiations with a vendor that was also supplying, I think, the MBA, and he said that the issue there was the cost of those test kits was $41, I believe is what I recall, and he was continuing to work with that. So Ms. Hsu can probably update you where they are with those respective numbers.
Right, so the plan with the NBA to make rapid testing available to the community is still underway. As of Monday, we are putting into operation a site, a DOH testing site specifically designated for schools in response to any cases identified. And so this would be for when we get reported cases from schools and there might need to be quarantine or there might need to be some kind of screening, we've been working with the Orange County Public Schools to determine how to get testing when needed in response to that. It's an undisclosed location. Thank you.
All right, so hopefully that you got the answer to that question. All right, thanks.
Steve Hudak from the Sentinel. This is for both mayors and Ms. Chu. We have schools opening tomorrow, the soccer team having fans in the stands, UCF students are coming back. All of our numbers have been kind of going in the direction we want them to go. What if they start going up? Is there a level at which you're concerned?
I think Mayor Dyer addressed the issue with the soccer matches. They have an abundance of sanitary measures that they're going to be putting in place, and I heard him say that they're looking at 20% capacity. So that's a measured approach. With our schools, you've seen the plans from OCPS. With our universities, you've seen and heard about the plans there. But every time we get to the point where the numbers are low, it creates, I think, a certain amount of desire by our community to reopen and re-engage in terms of consumer confidence. I think that builds the consumer confidence when the numbers are low. But I always remind people at every one of these press conferences that we still have to be vigilant. We still have a responsibility to do all of those things that we need to do to help protect ourselves and others. And that means the wearing of the mask to really embracing all of those CDC guidelines that you see there. So it's concerning to me when we reopen any of this. It's a living lab that we see here within our community and we see across the globe. If the numbers begin to increase significantly, obviously we'll have to make some adjustments, but we won't know. So we're going to experiment and see where it is in the coming days. But if those numbers begin to go back up to some of the days where you saw about 8 weeks ago, 6 to 8 weeks ago, then it's real simple. Well, then we'll have to make adjustments and begin to restrict certain activities within the community. None of us want to get there, so if we, again, do all that we can do in advance, maybe we can avoid that.
Steve, I think this is about learning to live in the new normal. When we first entered phase one of reopening, I don't think that a lot of people took it as seriously as they need to take it. If we want to have schools open, if we want to have ballparks open, we have to take the appropriate measures, and everybody has to use this. Everybody has to wear their mask, do their temperature checks. So it's a responsibility of every one of our citizens if we want to be successful in coping and living with this virus and having some sense of normalcy. We have to do the things that the medical professionals tell us to do.
Mayor, this question is unrelated to COVID.
I don't know if, before we move, I don't know if Ms. Shue wanted to opine on the same question that was asked by this.
Nothing too much different, but the cautious optimism is based on what we've been doing since the peak. And so, as I had mentioned previously, it's the collective measures that we put into place. DOH has been working with all of our community partners in a consultation capacity. So we are working closely with the Orange County Public Schools. We've also spoken with many of the businesses that want to open. And so we're working to try to put into place as many interventions and measures as we can to sort of reduce reduce the risk as much as possible. So our goal is reduction as much as possible. We're not going to be able to get to zero until we know that the pandemic is snuffed out, when we have no new infections for a period of time. So what we're working towards, we're hoping people don't get complacent in this lull, and being aware that flu season is coming up, we want to continue all of these measures because what works for coronavirus also works for influenza. Thank you.
Hi, Mayor. This question's directed to you. As the former sheriff of Orange County, what do you think of the way the current sheriff has handled the shooting death of Salithis Melvin? Do you feel like he's been transparent enough? And what would you have done, if anything, differently?
To be fair about it, I've had the opportunity to look at a couple of the videos, but I have not had the opportunity to see all of the videos, and I don't even know how many videos exist because it is an active criminal investigation, so I'm not privy to that in my current role as mayor. What I can tell you is that whenever you have a shooting situation, especially one that may be controversial, being more transparent is the best course of action, I think. There appears to have been some issues with the timeliness of when the videos were made public. They just happened to seem to be close to the period of election, but there might be some detail I'm not aware of regarding that. So I think that anytime that a person loses their life at the hands of law enforcement, it's always a tragedy for the entire community. It's a tragedy for the family. It's a tragedy for law enforcement. And so there's some details, there's some facts about that case that I'm just like everybody else. I want to see what it looks like. I want to hear more about what led up to the shooting itself. And until we have all of those questions answered, I will continue to have a little uneasiness about it. And I hope that in the coming days that we'll get more information, more transparency out of the sheriff's office regarding the shooting incident. And so I'll stop at that in terms of the technical issues related to it, because I have not had the opportunity to view. Unfortunately, I've just been busy. I haven't had the opportunity to view all of those videos. I can't really comment about whether everything was appropriate or not. But I do have some solace in knowing that the Florida Department of Law Enforcement is doing that investigation, and that may or may not be sufficient. There, quite frankly, may have to be additional review by the Department of Justice in that case. So we'll see. Okay.
Hi, Eric Sandoval with News 6. I want a complete answer just like Steve got to my question. I want to go back.
You always give complete answers,
I know you
right?
do. I want a full panel response just like Steve got. I want to go back to Orlando City soccer for a moment. So I'm going to I want to involve you too, Mayor Demings, because last Monday, this subject came up as far as the discussions, and you went on record as saying that you didn't think now is the time to be doing something like this. What are your thoughts now going into this? And Mayor Dyer, having walked the stadium today and gone through everything, what are your thoughts about their plans, and what role is OPD and OFD going to play in all this? What do you think? That's my question all across the board.
I'll lead off if you want. I did have the opportunity to do that. MLS as a league has put together some very stringent guidelines on how to bring fans back into stadiums. So they're doing this home and home thing. I don't think any of the three that we're playing against in the next couple of weeks, Miami, Georgia, or Atlanta, or Nashville, are going to have fans. I'm not 100% sure on that. But the plan that they put together, I quite honestly had reservations about it. Actually went and had Orlando Health walk me through it, and the team walk me through it. They've been extremely thoughtful. No one will enter the building without a temperature check and without wearing a mask. The spatial distancing for the seating arrangements that they have are, I think, appropriate. Having Orlando Health put their name behind it and sign off on it gives me additional hope that it will be successful. They know the risk that they're taking, right? If there ends up being an outbreak that comes from a game and they're shut down, there's ramifications related to that. But I was extremely impressed. We thought of every measure that you can think of in terms of how you walk through the stadium, the entrance being staggered. When you leave the stadium, you're going to do it by sections, so there will only be several hundred people at a time exiting through 5 gates instead of, and the number at 20% is about 6,000 fans if they all come. So they thought about how you're going to enter, how you're going to exit, what happens if somebody does have a temperature, what happens if somebody has symptoms during the course of the game, where do you isolate them, how do you keep players isolated from fans. So I'm just very impressed with what they've done. On the outside, we're also working with them to make sure, and I think this is important, the fans that will be there are season ticket holders. So they're interacting and communicating with them and setting expectations. So there's no tailgating. There's no march to the game. And I talked to them today about having ambassadors not just in and around the stadium, but all the way down Church Street so that they could help to educate and intercede if there's any non-social distancing stuff going on. OPD will be doing their normal game day type of thing, which is largely security and traffic control, and OFD is obviously the game day medical teams that are in the stadium.
I'm going to use Ms. Shu's term. I think I'm going to be cautiously optimistic. I think it's risky. But this is an area that under the current governor's executive order that we at the local level do not have the authority to stop it from happening. And so if we did, I think, given everything that Mayor Dyer just said, we'll just have to see. You know, if I had to make the decision myself, I wouldn't allow it. So there you go.
Just all of it scares me. So, large crowds, it's where you get large numbers of people together where they can interact, where it might be the riskiest. And so we have consulted with, DOH has consulted with the stadiums. I had mentioned before, so, locking everybody into their houses for 4 weeks until there's zero transmission is just not practical. So I don't have the tough decision. The mayors do. But we've worked with our community partners and the locations that want to open, such as the stadium, to try to put in as many interventions as we can. And so there's, external interventions, like if you're driving a car, you go from point A to point B, and there's external interventions like traffic lights and lane markings, and then there's internal interventions, seat belts, safety, airbags, and then there's personal responsibility. And so we want to emphasize, if we're going to do this, to try to reduce the risk as much as possible, because we're not necessarily going to be able to get to zero in a practical world. We will expect that there might be some cases, since it's circulating in our community, there might be some cases that end up in the stadium, or there might be community spread cases that end up in schools. And so we're hoping that personal responsibility, people wear their masks to contain droplets to try to prevent spread of COVID-19 in all of these public locations. Thanks.
Kelsey Thord with West 2 News. Mayor Demings, this is just kind of a clarification question. When you were talking about the eviction diversion program, you said that tenants and landlords have to both agree to do the program. Are you worried that some tenants will not agree some landlords will not agree and tenants will want to do it, but the landlord won't?
There are property rights. There's some legal issues here, and without mutual agreement, I don't think we could go forward under the current laws of Florida. That's why it will take both parties to agree to this. Okay, where are we now? Okay.
This next question was texted in from Victor Barrios with Univision. So Ilya Torres, if you can help translate, this is directed for Alvina Chu. His question is, and he was, we'll just wait a minute. His question is, Florida is reporting lower coronavirus cases than the state has seen in months. Do you think we should rush into full reopening?
So it's the same basic message that we'd like to emphasize. We are cautiously optimistic that the numbers that we are seeing are because of the effects of all the interventions together that we have put into place. Yep.
Small bites.
Small bites, yes.
Okay. El mensaje básico que tenemos es que seguimos siendo optimistas y cautelosos y estamos seguros de que todas las intervenciones que hemos puesto en marcha. May continue, Michu.
Well, I just wanted to emphasize about the personal responsibility. So the wearing of the mask to prevent transmission, to help prevent the spread, the social distancing, and also the good hand hygiene. And so that helps prevent yourself, and it also helps prevent you spreading it potentially to other persons.
I'll try my best. La respuesta que añade la señora Chu es que todo se resume a preparación personal, al uso de mascarilla y a tomar precauciones adicionales como el distanciamiento social y la higiene personal, lavado de manos, etc.
In English for you, Alvina Chu again from Jesse Canales from News 13. His question is, Alvina Chu, is there any data showing how COVID impacts multi-generational households? Will students returning to school impact some of these households? And what advice do you have for families in these households to minimize that risk?
So there's my second graph that I was going to show. It clearly shows that, persons who are getting infected, the median age still hovers around 36. And so there's younger persons, you can see on the left-hand side. So it's sort of plainly obvious. So, you can see from the left-hand side, the younger persons are going out and socializing more, perhaps, or maybe they have to go to work. But also the persons who are getting hospitalized, they bring it home, and the persons who get hospitalized could be their parents or could be their grandparents. And then the persons who are most severely affected are obviously the most vulnerable, the oldest of our community, and those who have comorbidities. And so what they can do with the prevention measures are all the interventions that we've mentioned. So staying away from large groups, observing the group sizes, being observant of group sizes and not having large gatherings, being socially distant if you have to be out in public, wearing the mask, social distancing, and the hand washing. So children could potentially, we do know that children can be infected, although they may not have a severe illness like some of our older population or those with comorbidities, but potentially they could be part of that multi-generational spread. And so inside the home, there is the recommendation for the isolation of persons who are sick to be away from others so that they can try not to spread it within a household.
This next question comes from Nikki Ziza, WKMG, also for you, Alvina Chu. Could reopening schools lead to a second wave or a lockdown or sustain the pandemic?
I think it's unknown. I mean, this pandemic is new to us, and we'll just have to be aware of what is happening, and which is why we're working so closely with our public school system to try to put into place as many interventions as we can. Also, we have the plans for the testing site, and that's for prevention, for screening, and also for outbreak response if there should be outbreak or sustained transmission inside the schools. And so we'll just have to keep in good communication with our school partners about what will happen.
Thank you. These last two are for you, Mayor Demings. This one's written in from Nassim Miller from the Orlando Sentinel. Mayor Demings, we know the virus is continuing to have a disproportionate impact on Black and Hispanic communities here. How big a concern is this to you, and what does it take to change this trend?
I think the reason why we may see disproportionate impacts in communities of color, it goes back to a historical I'm going to say disparities within the American society within terms of health care and access to quality health care. There are multiple other social phenomena, I think, that also impact that, to high unemployment rates in communities of color, high rates of housing, lack of affordable housing or quality housing, and all of those things, underemployment, unemployment, et cetera, all translates into the healthcare disparities that we see as a country. So I think that the pandemic has helped to exacerbate those healthcare disparities that already existed.
And lastly, from Ryan Lynch with the Orlando Business Journal, Mayor Demings, with the county business grant application portal closing on Friday, what additional measures, if any, is the county looking at to follow up that support?
Again, we are monitoring the dollars that we have, and within our overall spending plan, we have some contingency dollars there, and as we move forward and we have our actual expenditures, we may make adjustments and over time make reallocations of the $243 million that we have. Okay. Okay, is that the last? Okay. If that's the last question tonight, I know Mayor Dyer, you joined me, our Orlando Magic is in the NBA playoffs, and they'll be playing tonight, the second game in the Bucks. And so we're going to rally for our Magic and hope that they are victorious once again. Mayor Dyer, any comments?
Yeah, they lead the series 1-0.
All right.
Let's see if we can get a second.
So we want our entire community to rally behind our hometown Magic team. So thank you all for joining us today.